The World Health Organization says almost 2 billion persons are facing poor health spending. As we celebrate World Health Day, we take a look at how to ensure health for all in a world of 8 billion. Good evening, welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. The conversation begins in a moment. Please stay tuned.
Primary healthcare meets the majority of people's health needs during their life. It welcomes a child into this world, providing services like vaccines that protect us and our communities against infectious diseases. Primary healthcare supports us through childhood, adolescence, and adulthood, with services to keep us healthy, like guidance on good nutrition and physical activity habits. It keeps a close eye on risk factors, runs diagnostic tests, and can confirm a number of diagnoses right in your local community, be it at a rural midwife post, family doctor practice, city clinic with a group of doctors, a social worker in a community centre, or a pharmacist on the corner of your street. Primary healthcare also treats and manages a number of conditions through regular follow-up care, prescription medications, and further prevention, including chronic conditions such as hypertension, diabetes, and asthma, in addition to mental health and urgent care needs. Primary healthcare provides services for people of all ages to take charge of their health and confidently manage their needs, in partnership with their regular health providers, family members, and caregivers. It meets the majority of our health needs during our life, and even accompanies us into old age, adding life to years and years to lives. Primary healthcare needs our support, just as it supports us.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Alero Roberts, and she's going to share her expertise on how to achieve inclusive healthcare for all as the world observes World Health Day. Dr. Alero Roberts is a consultant public health physician. Good evening, Dr. Roberts, and thanks for joining us.
Good evening, Tumbo. Nice to be here again after such a long time and in such lovely circumstances with the end of the pandemic.
You can say that again. The world is observing World Health Day. How has the world fared since the declaration of World Health Day?
It's mixed with good and bad, in the sense that first World Health Day was first celebrated April 7th in 1950, which was all of 73 years ago, to raise awareness about global health issues and mark the founding of the WHO. And since then, we've made quite a few advances, particularly in the areas of reduction of infectious diseases, immunization programs, improved access to clean water and sanitation. We've made advances in medical technology, not the least being access to antibiotics, which are help to control bacterial infections, but even improved surgical techniques that have improved outcome for patients. There have been improved maternal and child health. There have been, thanks to the improved access to antenatal and postnatal care, better nutrition, immunization programs. We've even seen some reduction in the non-communicable diseases, from reduction in smoking rates through the various global campaigns and policies that have been aimed at reducing tobacco use. But there's always a but, that we still have challenges in other non-communicable diseases such as type 2 diabetes, cancer, heart disease, which are the leading causes of death globally due to our lifestyle habits, poor physical activity, poor diets. There's still a lot of health inequities. There are a lot of people in low and middle income countries and marginalized communities still experience not only higher rates of illness and mortality, but lower access to care. And of course, we have the emergence of new diseases. COVID, HIV, AIDS, Ebola have all come back. We are now seeing new viruses coming onto the fore. Marburg,
This year's World Health Day coincides with the establishment of the World Health Organization 75 years ago. What are some of the milestones recorded by the World Health Organization?
That is rather difficult to list. I mean, for Nigeria, I would say the establishment of the NCDC, the eradication of polio in the country. We've made a lot of milestones, the strengthening of the health system, strengthening of the primary healthcare system. There have been quite a few milestones, but to be able to list them now, no, I don't have that to my fingers. But certainly, we still have a lot of work to do in the area of sanitation and clean water and sanitation, the refuse disposal, the issue of plastic in the oceans. We still have some ways to go in that, some environmental challenges.
What does achieving health for all means? Oftentimes we hear universal health coverage, inclusive health care, and all that. Tell us, what does this mean?
Achieving health for all. Now, health for all is a global initiative to ensure that all people have access to quality health services without facing financial hardship. So it needs to mean universal health coverage. It should be that all people have access to the health services they need without suffering financial hardship. Expanding that means strengthening the health systems, improving health financing, expanding the health workforce, investing in essential medicines and technologies. It also means that we need to prioritize primary health care, which is essential health care accessible to everyone, which primary health care should be available at the doorstep for your health prevention, health promotion and treatment and rehabilitation at the community and household level. It also means that there should be health equity, which means that everybody has a fair and equal opportunity to achieve good health. And what they need is what they can get. So, and this will be different for different population subgroups. It means health security, which means protecting people even from the threats to health, threats of infectious disease, natural disasters, and other natural emergencies. And that will require strengthening the public health systems for disease surveillance, disaster response. That's another one, emergency preparedness. So these are the things that we would need to be looking at globally, nationally, and locally in order to say that we are going to get health for all.
Let us look at efforts towards achieving universal health coverage for a population of 8 billion. What must we be doing differently now to achieve our goals?
Basically, all the things I've already listed, investing in healthcare systems to tackle not only the health challenges of today, but also the health challenges of tomorrow that we need to be able to look at in order to increase access to healthcare services, and ensuring that there are enough well-trained, adequately equipped healthcare providers at all levels, both all levels of healthcare provision and at all levels of the community. How to encourage healthy lifestyles among our population, which are preventive measures for non-communicable diseases, even communicable diseases, encouraging healthy eating habits, encouraging regular exercise to prevent those diseases like type 2 diabetes and heart disease. Strengthening our vaccination programs can also help prevent the spread of infectious diseases. And underlying all this is constant research and development, investing in research and development to develop new treatments, new medications, new technologies. Right now, the world is facing a major threat of very few new antibiotics in the research and development pipeline, which means that if we continue at the rate at which we are with inappropriate use of antimicrobials, we'll soon get to a situation where we are facing the microbial organisms that are resistant to the drugs that we have presently. We saw a lot during the pandemic of collaboration between governments, between healthcare providers, researchers, communities. This collaboration must be strengthened, and we must encourage that sharing of information and expertise and resources to develop effective solutions to our healthcare challenges. There are also the other social determinants of health that we are not facing, and these are particularly prominent in the low and middle income countries. Poverty, inequality, lack of education can help improve health outcomes for disadvantaged communities and marginalized populations. So there's a lot that needs to be done, and it needs for us to collaborate with one another, both from government level to community level to family level, amongst all the strata of society.
All right, Dr. Roberts, earlier you upped on increased funding. Every year, governments allocate budget spending, budget funding for the healthcare sector. Is it all about allocation? What should we be doing in terms of spending judiciously?
That's where governance comes in. And governance is incredibly important and needs to occur at all levels. So that accountability, that transparency, budget performance analysis, all those things now come into play. And this is why we keep saying that in order to achieve health for all, it's not just a function of what the health sector is doing. We need collaboration, intersectoral collaboration between all the sectors, particularly finance, works, infrastructure, economy, everything, agriculture, education, everything has to collaborate so that even when you allocate these resources, there are people who are coming to say, right, these resources were appropriately allocated and have been judiciously used, and this is the outcomes that we have achieved, and these outcomes have shown that this strategy is cost effective. This is the cost benefit analysis. So that governance is vitally important. And without it, we can continue to allocate resources, then we don't see what the money is doing. And that should not continue.
At the core of this year's message is strengthening primary healthcare systems. We have them in every part of the country, but how do we increase their efficiencies so as to reduce the overburden on secondary healthcare facilities?
I'm so glad you asked that question, because that for me is a passion and a pain point and a topic that I can go on and on and on about. How much time do we have left in this program? Primary health care is not just primary health care, the concept, it's primary health care, the delivery, it's primary health care, the scope, the range, everything. So let me put it to you like this, because I think that's the easiest way to do it. As you are sitting there in the studio, and you suddenly feel a little off color. You're not sick, but you just feel a little off color. Where are you going to go? Are you going to rush straight to the teaching hospital and start standing in a queue for 3 or 4 hours to see a physician? No, you want to be able to go just to the neighborhood, anybody who has health expertise, healthcare expertise, to say, oh, this is the way I'm feeling, this is what I've noticed, and then they do a quick check and either reassure you or start preliminary management. That is what primary healthcare is supposed to be for each and every one of us. And each and every one of us can relate to the fact that sometimes you just wake up or something is happening and suddenly you're a little off color. Something is not quite right. There's a pain somewhere you can't explain. Where do you go? That is the importance of primary health care. And what we need to do is that primary health care needs to be revitalized and made very popular, so that not everybody goes to the tertiary or the secondary healthcare institutions, general hospital or teaching hospital or FMC, when they feel something a little off. Besides, people forget that it's at the primary healthcare center that you have a personal relationship with your healthcare provider. They know you by name. They know your siblings. They know your children. They know your spouse. They know the circumstances within which you find yourself. So they can relate what you're feeling to who you are in totality. They're not just treating a symptom, they're treating a person. And what we need to do is to be able to ensure that the primary health care is made popular. I love that word. It's the NMA Lagos used it. It's made popular for everybody. So you need to not only incentivize healthcare workers to stay at the primary healthcare center, B, you need to make it such that, like the primary healthcare center in my neighborhood is so pretty. There are plants growing outside. The place is aesthetically pleasing. Every time you walk in there, you are greeted nicely by name. The healthcare staff know you, from the gateman to the clinician. They all know you. And you go there, there's always adequately trained staff available in that area. I wish this was the situation all over the state and certainly all over the country. It needs to be, so that that is your first point of call as a person when you are feeling a little unwell. So that before the problem gets to a problem of general hospital proportions or even teaching hospital proportions, it can be dealt with, solved, cured, resolved completely. That is what primary health care needs to become.
Your call to action as we wrap up this segment, Dr. Roberts.
Primary health care. I think that every local government chairman needs to take ownership of all the primary health care centers in his or her area, in his or her local government area. They need to use it. They need to be seen to be using it. They need to encourage their staff to go there. They need to start and end programs there. They need to encourage school children to be seen there periodically, maybe once in a school session. They need to ensure that the immunization programs are carried out. The eye checks are carried out. The dental checks are carried out. The mental health checks are carried out. That can be the first port of call. Somebody wakes up and suddenly feels so depressed, so anxious about the situation going on. There are resources. The resources are available at primary health care to assist that first contact that the person has and reassure them or point them in the direction of more help if the primary health care provider feels that the person needs more help. But most and generally, almost 80% of situations can be dealt with at the primary health care sector. So my call to action is to all the local government chairmen to take ownership of their primary health centers in their local government area, their LCDA. Take ownership properly and ensure that they are brought up to date. They are brought up to speed in terms of staffing, in terms of equipment, in terms of the beauty of the place, and people are made to use it, certainly from their own staff.
Ownership of primary health care centers. Primary health care remains the nerve of universal health coverage. Inclusive health care means health care for all. Dr. Alero Roberts, consultant public health physician, thank you so much for your time and expertise on the show.
Thank you so much for having me.
Sound Health continues with trending health report from around the world. Please stay tuned. This is where we say thank you on today's episode of Sound Health. Remember, a vibrant primary healthcare system means inclusive healthcare for all. Make primary healthcare centers effective and accessible. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.